Hey guys, Don here. Welcome to Podiatry Practice Mastery, where we help you get to the $1 million mark and beyond. I'm going to record, this is a recording for a Monday. Now this Monday, I had a doctor's appointment with my dad, and I think I told you he's been kind of dealing with some dementia, so I brought him to the neurologist. So it's always weird when you go to see another doctor in their office, and so we got in. They have eClinical Works, so it was a kind of a nice system of logging in. I could make the appointment. He recently switched insurances. You have to put the insurance card there. And then they had these nice little signs up there that said, in the waiting room and in the room where I was waiting, if you've been waiting more than 15 minutes, please let us know, because I think that must be something that's common. So we got there, and we were seen like 45 minutes later. And so it's different being on the other side of the waiting. And we were just kind of sitting there waiting. It was over 15 minutes, but I didn't want to bug them. So I waited for a half hour and then waited for 45 minutes. And eventually I went and told someone, and then the doctor kind of popped in. So I think it's good sometimes to almost secret shop or go to other doctors' offices to see what it's like. So it wasn't a good feeling waiting there, at least having someone in say, hey, the doctor's on their way, he's aware that you're there. That's something that we try to do. I try to just pop my head and say, hey, you're going to be next. This is a little kind of a nuance that I do. So if I'm running behind, we have a flag system. So if there's one flag out with my name, that's the next patient, then there's two, then there's three. And so that's how we have this flag system to know which room to go into. So sometimes if I know I'm going to be a little bit longer with a longer procedure, I'll go to number 2 or number 3 that's waiting there, and I'll say, hey, just so you know, you're going to be next. I'm going to get you in there. I'm just going to take care of this other patient. I think patients like that, and it's just something I think is a good thing to do. So then it was a half day, right? So I've some of my production is going down, but like, this is what you have to do. This is the right thing to do in life. And, I'll still make it to the $1 million mark, I'm pretty sure, with these extra days off. So I just can't have my wife do all of these visits. So kind of a heavy EPAT day. So this was number 7 for EPAT. So this is a patient, they had 6 originally, 6-week follow-up. She's still having a little bit of pain, a little bit of thickness to the fascia with a little bit of effusion. And on the ultrasound, because I did another ultrasound, I did another Shockwave, and I'm going to see her back in 6 weeks, and she's going to get a prescription for PT. So she's going to go to PT, and then I'm going to see her back. So I did not do the PT originally. I'm not doing as much PT anymore, but in this case, she is going to do that, and then I'm going to be seeing her back. She already has orthotics. She has everything else. So I'm just letting you know the number, because I don't always go to 7. Very rarely I do, but this one I did. Next patient was a 55-year-old guy. This guy's got a sesamoid fracture. He got number 3 out of 6 for this fracture, and so he'll be back next week, so a couple more left. Next was a patient that had a Taylor's bunion, had pain. Most of my time was spent on shoe recommendations for this person. Okay, so shoe recommendations, anatomic shoes, things like that. Next patient was a 85-year-old female. This is a hard one. She has a lot of bad midfoot arthritis, bone marrow edema. And so for her, I did Shockwave number 4 out of 4 to this area of arthritis, not so much to bring the cartilage back, but to help with the bone marrow edema. And she's also being fit at Hanger for some type of like a meso type of AFO, because I could not do it due to her insurance. So she's going to be getting that brace soon to help that. She's not interested in a midfoot fusion, but she's going to be getting this AFO. So I'm going to see her 6 weeks after she gets her AFO. She should get her AFO next week. Next was patient number 3 out of 6 for plantar fascial pain, and so she'll be back next week. Next was a matrix follow-up. Actually, it was a matrix, and I'm going to do a follow-up in 3 weeks. And I'm specifying here now with our new medical record, I can use my 10-minute slots. I don't think I was using these shorter double book slots very well, so I've started to teach my staff like these little 10-minute matrix follow-ups, nail fungus follow-ups. These ones can tend to be quicker, and so I'm trying to add a few more extra patients in those. Next patient was a fungal nail follow-up, where they got the fungal nail kit that I do. And then the next patient was an 82-year-old that came in for nail fungus and I did a nail sample. This patient came in because we did an article recently in a local newspaper called the Community Advocate, and it had my beautiful face on there and everything, and so I've had multiple patients come in from that. What a lot of patients come in after being on like Formula 7 from another doctor, and they're not getting better. And the one thing that I kind of ask them is, like, have you had a nail sample first? I think you can look a little bit better than the one that they've seen before only by doing a nail sample, and also just being honest with them. I don't think that the topicals work all that well, and so I tell them that. I don't do that many topicals. Maybe other people do, and if you love them, if they work great, please let me know and what you're doing, but I don't find it works great. I tend to, most people, if they don't want to do the oral medication, I just have them live with it. And then this patient's going to come back in 3 weeks for this nail sample. But I really explained to them, you might not have to have treatment. She was all worried that, it potentially could have a systemic effect on her, like it would go into her bloodstream or something like that. And I said, no, that's not going to be the case. And then finally, the last was a non-op fracture care. This was one that I didn't see 2 weeks ago on the x-ray from 2 weeks ago, and I did see it today. So I actually did the fracture care today. Even though they were seen a couple weeks ago, I saw the metatarsal head stress fracture for this patient. And then I want to share one other joke here with what we're kind of dealing with in life. We found a new little candy store. It's called Parker's Candy Store here locally, and I brought my kids there to go there because they've been asking me forever to go there, and they have these really weird hours. They're like only open from like 10 in the morning till like 2 in the afternoon. And we went in there, and this was just an amazing candy store. It's like the old-fashioned candy store, like 500 types of candy. I'm wondering how many of these candies get expired. And we were looking around. They had like Now and Later's, the Charleston Chew, and my boy got a huge Tootsie Roll. This was like a $3.50 Tootsie Roll. So he brings the thing home, and I said, you gotta hide this stuff from Grandpa, because Grandpa, he likes sweets and he's got good eyes. Like his memory isn't there, but he can see anything. He has hawk-like eyes. And so my boy, he hid it under his like little Lego table. And I'm like, is that the best place to hide it? So he gets home, and my dad has opened up his Tootsie Roll and like ate a piece of it. And he was just devastated. And because like they're afraid that Grandpa's going to steal all their sweets now. And but what happened is that then Grandpa said, well, yeah, that's right, I'll buy you 2. And so he might buy some. Hey, that's not that bad. I'll start giving it to Grandpa, and then he'll buy me 2 more. So we have to go back to the candy store to get a couple more. Anyway, that is the day, and I hope you guys enjoyed this. Have a great one.